Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona June, co-founder of Kidney Coach and Kygenesis, a range of supplements designed to support those diagnosed with chronic kidney disease. And I'm delighted to be joined again today by one of my favorite guests, Lindsey Zirker. Lindsey is one of the head renal dietitians at Kidney Nutritional Institute. She works alongside Jessie Anna, and she is an absolute brainiac in all things hormonal pathways and minerals and endocrine systems. We've just been talking about our post-traumatic stress after writing chapters for Strong Nature and how we locked ourselves away and see daylight for a few days. So we have emerged from our caves, written and ready to go. So we're going to continue the topic of minerals, which is what we've been ticking off. If you haven't listened to some previous podcasts, we've spoken about minerals in general, zinc and magnesium, if I'm not mistaken. And today we're going to dive into, I can't remember if calcium's in there, but today we're going to dive into all things selenium. Lindsey, thank you for joining me again.
Thanks so much for having me, Fiona. It's always fun to have a nutrition, kidney related chat with you.
Yeah, I always enjoyed it. I always enjoy our pre-chats before we hit record too.
Yes.
So, selenium, let's start there. So first off, high level understanding. What is selenium? As far as what is it for people? And then we'll just dig down from there.
Yeah. So selenium is a mineral, and most the form that we most hear about is called selenoproteins. Um, they play a pretty big role in antioxidant defense, thyroid function, immune function. Those are the kind of big pieces that it plays. And it is, yeah, it's not something that we hear a lot about from food sources or things. I feel like outside of kidney world, we mostly hear about selenium with thyroid
Yeah.
and antioxidants. That's pretty much all. So, excuse me.
Bless you. So why would we, so anyone out there thinking about kidney disease and they're like, is selenium important? Because, we often hear about selenium toxicity. It's one on all the back. I don't know if it's the same in the US, but all the back of supplements, they'll always put a bit like vitamin A, they always have a toxicity load. The selenium is, and I guess kidney people are always like, well, if it's going to potentially have a toxicity load, is it something I avoid? Is it something I put in? So tell me about the link between pros and cons about maybe why we would think of selenium when it comes to chronic kidney disease.
So, with like most of the nutrient research in kidney disease, it's not like very prolific.
No.
So that makes a lot of the warnings a lot scarier because we don't have heavier, weightier stuff to kind of contradict that. But what the studies have found is that there is definitely a positive correlation or a positive link between people's selenium intake and their kidney health. So, for example, people who have increased selenium intake have a reduced risk of CKD. Like, that's not
Oh,
even talking about progression, that's just like development of kidney disease.
interesting.
Now, why is this the case? Like, did they dig into that? Not really. But because selenium is so important in helping with oxidative stress reduction and stuff like that, um, you know, any opportunities to support those pathways are going to probably decrease that risk of any chronic disease, probably. Um, but they also found that when people supplemented with selenium, that it improved long-term outcomes in those with CKD. Um, and even in people who were on dialysis, they found that they had improved albumin levels, which is closely tied with inflammation.
Yeah.
And so from those specific perspectives, definitely helpful. But then also because kidney disease has this weird situation where they have suppressed immune systems sometimes
Mhm.
because of all the inflammation and stuff going on, but then also other inflammatory pathways that are more active. So they have some aspects of their immune system that are suppressed and other aspects of their immune system that are psycho. And um and so selenium can help with that. We know that there's a lot of different nutrients like zinc and vitamin D that help modulate that immune response, and selenium can play a role with that as well. So I think that's really helpful for people with kidney disease. And then because you need selenium to help with that T4 to T3 conversion of thyroid, and there is a really strong link between thyroid and kidney. Like if you have thyroid disease, then that can have a negative impact on your kidneys. If you have kidney disease, that can have a negative impact on your thyroid. So it's really nice to have selenium there to make sure that that's not, adding fuel to the fire.
Yeah, that makes sense. No, it's actually, you beat me to it. I was going to say, can you dig into why it's so important in thyroid and link it to kidney disease, which you've just done.
Oh,
So for anyone,
perfect.
yeah, for anyone that doesn't know, there is definitely a correlation between thyroid disease and kidney disease. It's something as clinicians we often look for, chicken and egg, and which one's going on in which direction. So that's
Mhm.
super interesting. So, what else do we need to know about selenium? As far as you mentioned something before we hit record that I didn't know, and that was the role of selenium in calcification throughout blood vessels. I thought that was really interesting. Tell me more about that.
Oh, yeah. That was something that as I was kind of prepping for this that I came across. Um, and let me pull up my reference. I think that vascular calcification in kidney disease, like I feel like we hear about it all the time because excuse me, like high phosphorus and high calcium and stuff like that. But But then there's other studies coming out about like how phosphorus binders actually don't reduce vascular calcification risk.
Yeah.
So awkward. But that especially for people on blood thinners, that like vitamin K and vitamin D can really help reduce vascular calcification there. So I think that there's quite a bit that we don't really understand about it, but with some of the small amount of research that is done, that it kind of goes back to selenium's role as an antioxidant, that it
Mm.
helps reduce that oxidative stress happening in the blood vessels, so that calcification um, is is at the least slowed down. So
Super important, because that obviously that fibrotic process that happens in end stage kidney disease is something that we want to obviously avoid.
yeah,
So seeing that selenium plays a role in that, and that maybe, that mechanism along with its antioxidants suggests why even in dialysis that selenium might be,
yeah,
really interesting if it's breaking down calcification or preventing it. I can see how that works.
yeah.
Um, what other, before we dig into more of the food sources and things, are there any other roles of selenium in the body that you want to cover before we move on? Obviously, you've talked about immune, antioxidant, and thyroid health. Is there any other areas that people might not be aware that selenium plays an important role?
So sometimes when I'm trying to understand what vitamins or minerals do in the body, I take a look at their deficiency or toxicity symptoms, because
Mm,
that kind of gives clues as to what could happen. So if someone has low selenium levels or selenium deficiency, they can definitely have poor immunity, but and like thyroid dysfunction, increased oxidative stress, which that seems, yeah, that makes sense because we know it plays a significant role with those. But we also have found that people can have reproductive issues, cardiomyopathy, asthma, um, hair loss. Everyone's always like trying to OD on their biotin to fix their hair, but that's not the only thing, right? There's so many things in almost any kind of chronic disease that cause hair loss. The hair's like the weak link, ironically. Um,
yeah.
like the first thing to show up. And then there is this thing called Creshan or Cashin-Beck disease. Um, which is the like defining thing, and that is specifically looking at the heart. It's called heart muscle disease. It is specifically from a selenium deficiencies in areas where there's low selenium content in the soil, and is a viral infection that can trigger the cardiomyopathy.
Interesting. So, selenium deficiency, you're more likely to get this viral infection that causes it. So that it's linked to the immune system that way, or?
So it just said that, it was primarily in China where they had really selenium deficient soil, and it is rare, but that it can be a selenium deficiency, it can be a viral infection. And I think, like, kind of thinking back, like maybe that virus is kind of there, and then a selenium deficiency or other suppressing immune functions can allow that virus to be active. Um, but it is really, really rare. But it
Okay.
just makes me think, like, why is it like specifically impacting the heart? And
Mm,
of course, like, doesn't really talk about that. But I think that, something that, we can kind of keep in mind, and also like thinking about, why does selenium, contributing to reproductive issues? Like, it's not really that specific, but I think, maybe there's specific oxidative stress that targets, that reduces, healthy hormone balance, or, oxidative stress that occurs in the reproductive organs, and selenium supports health in that way too. Like, it's a lot of speculation. There's not tons of research on it, but yeah.
interesting. So, delve more into deficiency. So, if we had a selenium deficiency, so I'm hearing hair, thyroid issues, maybe more viral loads. Are there any other really specific, if someone was like, well, do I need selenium? Signs and symptoms that we can attribute, or things that people might spark someone to go and have their selenium tested? And then I'll get you to tell me how we test selenium. But yeah, deficiency
Yeah.
sign.
So unfortunately, they're all pretty nebulous. Like, you notice, oh, I'm getting like every cold that comes through here. Okay. Um, like I said, asthma. So if you didn't really have, breathing problems, and then you're like, this is kind of unusual. Of course, there are a lot of other things that can contribute to asthma type symptoms as well.
Mm,
An increased oxidative stress, that is like majorly broad. And so how would you know? And then hair loss. But I think, like, for myself, when I'm wondering, like, is there a selenium issue for my patient? My first stop is going to be, what is their intake like? Because that way I can, see. And so here in the States, we have the RDAs or the DVs or the DRIs, the whole alphabet soup, which is like the bare minimum amount for healthy people. So, but the thing is like, most people never even meet those bare minimum amounts, right? So here in the States, it's 55 micrograms a day. And so if I have my patients, track their food, or, you can just track your food yourself, and make sure that you're getting consistent data on selenium from your foods, then you can see, um, if you're like, wow, I have, 16 micrograms a day on average. Yeah, probably you need more.
yeah.
So we also have there's a UL set for selenium, and that's 400 micrograms, which gives you a pretty big gap, which is kind of nice, because it's like, here's the bare minimum, and then here's the ceiling. So
Mm,
somewhere in between you probably need. And I think that's nice, because that does allow you to accommodate for, oh, well, I have kidney disease, and that is an inflammatory condition. Do I have other types of inflammatory conditions going on, like chronic stress?
yeah.
That would, maybe indicate you probably need more than that bare minimum of 55. But if you're not getting that, then, which I think is just helpful to know, because that way, you know, because this particular nutrient doesn't really seem to have that specific of deficiencies,
Yeah.
that, like, whether you have deficiency symptoms or not, if you're getting significantly lower than 55 micrograms a day, like, you're gonna have symptoms sometime or other. So
Yeah. And I
better take
wonder
care of
about,
that.
yeah, and I wonder about the chronicness of subclinical hypothyroids that I see in clinic
Yeah,
day in, day
valid.
out. Yeah. And I'll ask you about the foods in a minute, but I want to circle back to the fact that you'll see pretty much every multivitamin, at least in Australia, or thyroid supplement that's got selenium in it, with a warning on the back about selenium toxicity. So walk me through that. What does a selenium toxicity look like? What dosages are they talking about when it comes to toxicity, and what should people look out for?
Yeah, so toxicity symptoms, there is one that is oddly specific, but this takes place at mega doses.
Mhm.
One study found that people will have more of a garlic odor of their breath when they're
Yeah,
eating more than 900 micrograms a day.
big doses.
So,
Yeah.
yeah, so that's more than double what the UL is. So, the upper limit. So that's like pretty clear. It's like I have had no garlic and yet my breath smells like garlic. Okay,
Mm.
I need to not eat Brazil nuts anymore. Okay. But other symptoms are also kind of common with some other mineral deficiencies. So it's a little bit tricky because these are toxicities, but nausea, diarrhea, hair loss for deficiency and toxicity. Tricky.
Mm.
Abnormal nails. What does that mean? I don't know. Do you have insight on that?
What was it? Abnormal nails?
Yeah.
Oh,
I don't know,
I
because sometimes they're like spoon shaped or,
Yeah,
things
like we
like
know the
that.
iron one's very specific, and then if you've got that
Yeah.
infection through the cardio in around the heart in the
Yeah.
peritoneum, in the
Hmm.
pericardium, you get those blood splecks, you zinc spots, but selenium nails. No, I do know sometimes the zinc spots can be a bit selenium. Sometimes you
Mm.
think it's zinc, and that can be those white spots on nails can sometimes be a selenium deficiency.
Yeah,
Um,
that's totally true. I forgot that.
And I wonder if you're talking about hair growth, whether it's just, that biotin look where the nails are weak and brittle and breaking, whether maybe that's what they mean.
Yeah. Something that I should dig into a little more.
Mm.
Um, peripheral, oh no, not that one. Fatigue, irritability, those are other ones. So some of these symptoms, again, not very specific.
Mm.
So that's where sometimes it's helpful to get some testing done. If you're wondering about it. Um, but we always remind ourselves about minerals in the blood. It's always shifty.
So how
So
do you test? What's your, I mean, I know how I like to do selenium, but what's your preference for testing selenium levels?
So, you can test the serum levels, and the recommendation is it has it to be less than 70 nanograms per milliliter. But you can also test for selenoproteins. So if the selenoproteins are low or you're less than 70, then that can indicate deficiency. I feel like for minerals, because we know that minerals are stored in different forms, they're stored in different places. So serum levels are only giving us a really small part of the picture, and then a lot of minerals are controlled by hormones. So if we can get multiple data sets. So I think looking at the serum as well as inside the cell. And now I can't remember if it's red blood cell or white blood cell that we look at. Um,
I think it's red
but
cell, isn't it? I think it's red cell for selenium. Yeah.
that's what I was thinking, but then it was escaping my
Yeah,
mind.
you're right.
So, but a lot of the mineral tests, like the functional vitamin micronutrient tests, they're going to test for, so you don't have to know. Um,
Yeah.
and I think that, if you're suspicious of a selenium deficiency, like if there's a specific thing that you can nail it onto, um, then okay, fine, just test for that. But most of the time, if you're like really deficient in one mineral or one vitamin, you're probably deficient in others. Like isolated nutrient deficiencies are not common. So there's probably a lot of nutrient deficiencies. So it's kind of, I don't know, it's not very fruitful to just kind of cherry pick different micronutrient tests
Mm.
because the micronutrients all work together. And so sometimes if, like, I think we talked about this with magnesium, like you need B6 to help get magnesium into the cells. And
Yeah.
so, like, you would want to see what's going on with B6 as well as magnesium if you're suspicious about your magnesium functionality. So I think that just doing a big micronutrient test would be the most insightful, rather than just one individual.
Yeah, it's such a good point. I run something called a Nutristat, which is a test we run in Australia on all my biohacking guys, and it's actually my favorite test because it tests everything. But it runs minerals. I'm trying to think how it does it. It's not a urinalysis, maybe it is, or it might be plasma. Maybe I'm testing plasma levels, but plasma minerals. Yeah, it could be. I have to go back and have a look at what it says.
You know,
But
why can't we remember what it is?
oh, I think it's a plasma, but it is interesting that you're right. When you see minerals down, you see them all down. And then I'm generally using a basic mineral supplement, and it's a common thing to see mineral deficiencies in these people. And these are generally my biohacking clients are generally a healthy population that are trying to optimize. So it's not like they're unhealthy with chronic diseases, but you will see chronic mineral deficiencies. And the minerals that I see the most: zinc, magnesium, selenium. And when you see low selenium, and I was going to ask you about this, you often see heavy metals being an issue because selenium is one of the big binders to some of the big heavy metals. So I definitely see that correlation. But they're the three: zinc, selenium, and then you'll see what I would call a subclinical hypothyroid, where maybe TSH is sitting at like 2.3 or 2.8. So they're saying normal reference range, and I'm like, anything over 2.5. WHO is flagging. And so I see that pattern, I would say, and again, I'm testing a healthy population, generally young men that are biohacking without chronic disease. So I'm not even talking about my chronic disease patients. And I would say 60 to 65% of them will come up with that combination of magnesium, zinc, and selenium, a slightly raised, they're not in the red, but slightly raised heavy metals, generally low mineral pathway altogether, elevated cortisol, TSH bumping around the 2.3 to 2.8 mark, and hypergesterone, low testosterone. That is a clinical pattern that I would see in that subclinical population all the time. It's so fascinating. And you fix minerals and gut and stress levels, and generally everything will move back into place by itself.
I keep going back to that. I was talking with some other dietitians today, and I was just like, I feel like it almost, I think we've said this before too. It doesn't really matter, like, does this person have kidney disease? Do they have autoimmune? If they're like under eating their macros, if they're under eating micronutrients, if they're super stressed, like, it's going to be really difficult that any other one intervention can overcome the bad of all of that. And
Yeah.
so, like, those things really muddy the water quite a bit.
Mhm.
Like, you might think, oh, I have asthma. No, just fix the selenium. Or, like, my hair is falling out. Like, okay, well, it's probably some kind of mineral thing going on. And so it's just really interesting. That I'm just thinking, like, let's look upstream here. What can we do and clarify what's really going on with this person, and making sure they're well nourished and their stress is managed just really seems to take out a lot.
Oh, 100%. I was just running a biohacking retreat in Bali, and I keep saying to these guys are like, peptides, we want to do hormone optimization. I'm like, stop. I'm like, do you know what is the biggest ROI in health? A really good diet, managing your stress levels and gut health. I'm like, get those three right. 90% of your symptoms will go away, and then we can optimize you. But that'll get you from 50% to say 75%. You'll be feeling
Right?
amazing. I'm just
Yeah.
tweaking at the high end. You don't need to spend $50 million on crazy peptides. Get this stuff right. And then when we optimize you, you will feel superhuman. But I have to have that conversation over and over again that people want to bypass the stuff. And I'm like, biohacking 101 is actually doing the really hard things that no one wants to do, taking out alcohol, reducing coffee, I'm like, that is biohacking. You look at the blue zones, they're not injecting themselves with hormones and peptides. They have got good connection, good community. Their stress levels are down. They eat a really nutrient dense diet. They're exercising, moving, getting sunlight. Like, I'm like, that is biohacking. That is how you get your health right. And all the other stuff is optimization, but it's, we make it far more complicated than it is. And you're right. It's like getting those
Yeah.
things right, really gives you a good foundation. So I'm glad you mentioned that. Now, okay, so food sources, what foods are nice and dense in selenium?
So the favorite that I feel like most people know about are Brazil nuts.
Yep.
Has like one Brazil nut, what is it, like 65 milligrams of selenium a day. Of course, because remember I brought up about the soil, it's going to depend on where it was grown and how nutrient dense the soil was. And that's where it is for a lot of minerals too. So I think that if you're just like, I feel like it might be kind of low, like, yeah, you don't want to be eating a whole bag of Brazil nuts, even if you're eating like low nutrient soil. But if you
Yeah.
do have a genuine selenium deficiency, sometimes to just get you up over that hump, I feel like a supplement is nice because then you know you're getting a consistent amount, which is not necessarily always guaranteed from food.
Mm-hmm.
Um, but Brazil nuts, they're super helpful. Meat, fish, and poultry are great sources of selenium, and it's really bioavailable from those food sources.
Mm-hmm.
Sunflower seeds and eggs as well. Those are like the top sources of selenium that I have found, like add in as few foods as possible, and that's where you can get that. So
Interesting. And you also mentioned co-nutrients like B6 with magnesium. Are there specific co-nutrients in the selenium picture that if you're deficient in that, you can supplement selenium till the cows come home and it's not going to integrate into the
mm.
cell?
Yes, so vitamins A, C, and E help increase selenium absorption. But interestingly, um, vitamin E deficiency is super common with selenium deficiency because they're so synergistic with their
Yes.
antioxidant roles. And
Mm-hmm.
then also, iron deficiency is really common with selenium deficiency because of the increased oxidative stress
Yes.
that disrupts iron metabolism. And so that's going to I don't know if we talked about iron or anemia much on here, but
We haven't.
the
We'll have to do that one
iron
next.
is really bad to have high. So there's a lot of hormones in play. So hepcidin is a hormone that's really high in inflammatory states so that you don't absorb too much iron and feed bacteria. And so um, if you have a lot of inflammation going on because of a selenium deficiency, then it's going to inhibit your iron absorption. So you can
Mhm.
find kind of pockets of deficiencies together because they're interacting in that way.
Fascinating. And it's interesting, I'm thinking back to all our practitioner-only products, and you'll almost always find a vitamin E supplement will have selenium in it. They go together. We're often for
Yeah.
heart health. You're supplementing vitamin E. You're generally 9 out of 10 times that practitioner-only product has put selenium in that product.
And I think it's really important just thinking about how antioxidants work, because like we hear those studies about, well, you know, we added more of whatever, like I think it was vitamin E because it's supposed to help with heart health. But when they supplemented with vitamin E, they got worse results. But when they had diets high in vitamin E, it was good. And I'm just like, did everyone forget biochemistry and how antioxidants are like a bucket brigade? They have to be regenerated. So if you just dump a bunch of vitamin E in and it doesn't have any of its regenerating factors, like what's going to happen? You're just adding some fuel to the fire there. So I do think it's really important. And I love that when, companies and practitioners remember like you need antioxidants to be in a group together for them to be effective.
I'm so glad you covered that. And that's, for people that are like, well, are there clinical trials and done on this and that? And you're so right. In nature doesn't work in isolation, right? So you've got a plant or a herb. I would say this with herbs, like we often extract certain biochemicals out of herbs and then make a drug out of them. But I'm like, the reason the actual herb, let's talk about salix, willow bark, and aspirin comes out of that. And you get the similar effects using willow bark without all the side effects because it's got all these the plant produces these co-chemicals, so you don't get, say, the gut issues
Yeah.
and things like that you would with aspirin. And it's the same, like vitamin E in isolation actually can be worse, and that's why the studies, and then everyone's like, well, supplements don't work. And I'm like, just nutrients do not work that way. Like they have to go in with their friends
Yeah.
and their pals, and and so isolated clinical trials in natural medicine is really tough because it's not how nature intended. It's not how it works in the body. And so we often get these things saying, B6, we've got problems in Australia at the moment with B6 toxicity. And I'm like, well, you're using a crappy form of B6, not P5P, when we weren't using these forms ages ago. And, again, in isolation with all the other things. So I think that's a really good point. And for people to take away from this is just dumping one nutrient in at a time to see if that has a impact and a shift on your disease status. And like kidney disease isn't really how nature works. And going back to what Lindsey and I spoke before about nutrient dense diets and getting alcohol, I often find too, like that profile picture I spoke about in people with those low minerals, the anion gaps are all high, meaning they're acidic in the body. You make them more alkaline using minerals in citrate form, and it is fascinating how the body will absorb them all. So there's this big process that goes together that, well-versed clinicians such as Lindsey really understand in depth, and you get a far more holistic view than, say, not to shit on doctors that have done 4 hours of nutrition and are going to give you something in isolation and say go away and take it. It's like, it just doesn't work like that. So it's such a fascinating point, and minerals seem to be big in this bucket, aren't they? So they need all their friends. They don't like being alone.
They're extroverted.
Yeah, they're extroverted. They need their pals. They're on a party bus.
Yeah, they definitely are. So I think that in general, like selenium deficiency, like frank deficiency, is not going to be super common in general, unless you have like malabsorptive conditions, extremely poor appetite, bariatric surgery kind of situations. I think a lot of the CKD population is probably going to be more of those subclinical um, insufficiency kind of situations, which I think that medical world and nutrition world is still trying to understand about subclinical and insufficiency, because so many of our tests are designed to find like when things are really far gone, not when they're headed the wrong direction. But I think if, you're looking at your diet going, I really am not eating that much. Oh, I also have a bunch of gut issues. I'm probably not digesting or absorbing my food well. Or, oh, I've been on, omeprazole. And so like I know my stomach acid is low, so that's going to prevent absorption. Everyone always focuses on minerals with that, but it's going to prevent absorption of everything,
Mm.
depending on how long you've been on it. So you can kind of think about from that aspect, like, am I giving my body a chance, like by eating those foods? Does my body like have the tools it needs to absorb those nutrients, or is there a really heavy load? Like heavy responsibilities on selenium or other antioxidants because of oxidative stress. Um, those can be kind of red flags. Those are kind of things that I look for to see, does this person need some support with selenium as well as other things?
Yeah, no, really good point, Lindsey. Thank you. Is there anything else that you want to add about our friend selenium before we wrap this up?
Well, I will say I was looking at my cheat sheet here. I did see there was one study that said, hey, we think for people who have kidney disease, maybe a daily intake range to aim for would be like 90 micrograms of selenium.
Oh,
So
a
that's,
Brazil nut and a half.
yeah. So it's not quite double the daily value or whatever, but again, give some wiggle room there to make sure we're avoiding those insufficiencies, and keeping in mind that if you are working with a practitioner and you are found to be deficient or even insufficient, then you're going to need more than that daily recommended amount, because we've got to take care of the slack or that gap that's been created with that inadequate intake or absorption. So people are like, oh, that's more than the daily amount. Well, you need more because you had a lot less for a while.
Yeah. So 9 milligrams.
Yeah.
Yeah.
90 micrograms, 9 milligrams.
9 micrograms, sorry. Perfect. Excellent. Well, if anyone out there is listening to this and they want to work with a very well-versed practitioner in all things functional nutrition, head to www.kidneynutritionalinstitute.org, and there you will find all things Lindsey. You can connect with her via telehealth and anywhere in the world, regardless if you're in the US or not. She works with people around the world. Probably the most well-versed person I know in the role of hormones in the background of chronic kidney disease and then how minerals sit in and all of that. She's a deep diver, deep thinking brainiac. So highly trust Lindsey with any of my patients if they need support that way. If you want to know more about what we do, head to www.kidneycoach.com. Make sure you hit subscribe and like. That way you'll get notified about any new content that we put up. I think next time Lindsey and I will do a deep dive into iron because it's a big thing in chronic kidney disease. So we'll have a chat about that. So yeah, make sure you subscribe and that way you'll know when we put that content up. Lindsey, as always, it's a pleasure to connect with your beautiful self. And thank you again for being part of my amazing team that I get to connect with. It's always great.
Thanks, Fiona. Always love being here.
Yeah, thanks for being part of our community. We look forward to seeing you next time and enjoy the rest of your day. Bye.